1-month anniversary of the earthquake, and the question I get asked a lot when I call home and talk to friends and families is it better? And of course, the answer technically is yes, it is better. Things are better, but they're not good, and they're not normal, and they're not good by any stretch of the imagination. We've been spending a lot of time today going to places that we were a month ago or even 2 weeks ago to see how it compares to the way it is now. And in a moment, we're going to introduce you to some of the kids that we met, even some of the kids we saw being pulled out of the rubble in the first couple of days after the earthquake. We're going to give you an update of how they are doing. We wanted to take you back to General Hospital, which is a place that Dr. Sanjay Gupta visited an awful lot, and also that we went to immediately after the earthquake to take a look at how it was then and how it is now. Take a look. The last time we were in General Hospital, about a week after the earthquake, supplies were low and frustration high.
I've had enough, okay?
Yes, that's the problem.
I've had enough.
In the pediatric tent, a girl constantly screamed in pain. The Haitian American doctors and nurses were doing the best they could.
I don't even have someplace to wash my hands. I have one bottle of hand sanitizer. We can't do anything under sterile technique. It's impossible not to have, horrible infections.
Now, 1 month since the earthquake, General Hospital is calmer. But for the volunteer doctors and nurses, it is still overwhelming.
This lady got raped, and there's nothing in place to help her. And there's no resources, nowhere to go, and she's dealing with it alone. She's afraid to go home. She cannot tell her husband, and she has to put a good face when she goes home, and that is very heartbreaking.
Do you think people really understand what's happening?
To actually know what's going on, they have to be here to experience it. Because I know when it first happened, I was glued to CNN. It was like my lifeline. I was hooked to it until I came here and saw the reality of what's there. I think you have to really come here to feel it.
Dr. Sophia Lubin is an OB/GYN from New York. She's been here a week and leaves tomorrow. So what's it been like for you?
Well, initially we were just so excited to be here, just kind of like really gung-ho because we were able to come down and, give a hand. But over the course of the last couple of days, it's just gotten harder and harder, because reality really sets in.
In what way?
The sense of just the sheer devastation, the sheer amount of things that just can't be done here because we don't have the supplies, we don't have the facilities up and running really the way they should be.
Even now?
Even now, a month later today.
Newborn babies are watched by their mothers or fathers. Family here is essential for good care.
After you deliver a baby, your family has to come and bring a little towel to actually wipe down the baby, something that we take advantage of so much in New York, just in the States, we are so fortunate that there's nurses and techs and someone who's always there to kind of like help with the ancillary stuff. There's nothing like that here.
In the postpartum tent, mothers who delivered this morning are allowed just a few hours rest before being sent out into the streets. That's got to be a strange feeling. I mean, in the States, you're sending somebody to a home. Here, you don't know where you're sending them.
It's really impossible, actually, sometimes to think about it. How can we make this a better life for them? How?
And that's what you ask yourself every day?
Every single day that I'm here. How can I make a better life for people that are living here?
That is the question. That is the challenge. It's been 1 month since the earthquake, and there's still no clear answers. Yeah, no clear answers to that question because so many of the system's shortcomings were here in Haiti long before the disaster. So the answer right now seems to be for everyone just to do what they can and do the best they can. Sanjay Gupta certainly has, and this week he's been revisiting some of his patients